All right, I'm going to summarize Peter Attia's Outlive book, The Science and Art of Longevity. So in the beginning, he talks about the general concept of longevity and trying to live and expand your health span, how long of your life you're healthy for. Here he brings up the point of the marginal decade, which is like the last decade of life where a person just ends up in doctor's offices instead of enjoying the last 10 years of their life because they didn't plan ahead, essentially. Chapter 2, he talks about medicine 3.0. This chapter is actually really good. It talks about the issue of do no harm, that if you aren't proactive, and sometimes you might have to put yourself a little bit in harm's way in order to perfect your longevity and health span. An example of that is taking like anti-cholesterol medications sooner than most people might, or getting imaging done, or getting like an early colonoscopy, something like that. The general concept is that we can do a lot better diagnostics now, like genetic testing, things that might not even be covered by insurance, better blood testing, like checking for ApoB or LP(a), for example. And by doing these diagnostic testing, we might be able to get ahead of diseases much sooner. So we have to do better diagnostics for longevity, and the do no harm. A lot of times doctors might withhold diagnostics for incidental findings, and that might not be beneficial. Then he talks about kind of the strategy versus tactics, like what's the main overall goal here, and then how do we actually individually achieve those. He talks about centenarians in general, and the general concept is that the older a person gets to, the healthier they were throughout their life. A big chapter on metabolic health. Essentially, there's 3 ways to lose weight. All of them cause a calorie deficit. Those are going to be improving the quality of your food, so the foods themselves are less calorie dense, decreasing the amount of food that you're eating, like calorie counting or portion control, or intermittent fasting, where you decrease the frequency of your meals. So taking a step back, he does talk about the 4 horsemen of chronic disease, the 4 horsemen that usually will take the life of most people who live long enough, which include cardiovascular disease, neurovascular disease like Alzheimer's, metabolic issues, and cancer. And metabolic health can lead to all 4 being worse. So metabolic issues can be type 2 diabetes, but they can also worsen cancer. They can increase the risk for Alzheimer's. They can increase the risk for cardiovascular disease. So there's a large emphasis on good metabolic health, decreasing the weight, and remaining in a healthy BMI. There's a whole chapter on the heart that talks about decreasing cardiovascular risk. The main takeaway here is check your ApoB levels, which is a marker for like LDL cholesterol, the bad cholesterol, and then get those as low as possible, which will likely involve some pharmacological interventions, like getting checked for LP(a) at least once in your life, and making sure you have good cardiovascular health in terms of exercise. Next, they talk about cancer. The main thing with cancer is that if you have a solid tumor, it's much, much harder to survive the later it's found. So the earlier, the better. And if you do screening and catch it really early, there's a much higher likelihood of surviving. So in this case, he's really just talking about cancer screening. Make sure you talk to your doctor, talk about the family history, get your colonoscopies on time, get your screenings for mammograms on time. If you're a smoker, get your CT scans, get all of that stuff on time as your doctor might recommend. He kind of emphasizes even more aggressive screening. So like instead of the age of 40 getting his first colonoscopy, instead of 45, maybe getting it at 40. There's quite a bit here on Alzheimer's. This is kind of more niche specific depending on a person's genetic testing, but for the most part, it's going to be exercise and diet. So if you do the other stuff, the Alzheimer risk also decreases. Huge emphasis on exercise, calls exercise the most powerful longevity drug. Essentially with exercise, there's going to be 4 different types. There's going to be cardiovascular, low-level activity, which he calls zone 2. That would be like walking or riding a bike, something like that. Resistance training and mobility and stability to prevent falls as a person gets older, which is a major cause of issues as a person gets older. And then high intensity interval training or high intensity cardio. You should do all 4. You should do the low level cardio activity the most. And you should be careful that you don't start doing like heavy deadlifts, injure yourself, and then you can't do the other modes of activity. The goal is to live longer, not to be to bench as much as possible. So he talks here about the Centenarian Decathlon, which essentially kind of creates living to 100 to be like a sport. So essentially figure out what you want to do when you're later in life, like when you're 90 years old. What do you want? Do you want to be able to pick something over your head, play with your kids on the floor, and then work your way backwards in creating your own exercise regimen so that you can ensure that you can do that later in life. Heavy emphasis on stability. I will say that falling is a major cause of problems when a person gets over 70 years old. So definitely stability is an important factor there. Heavy emphasis on sleep. Main thing with sleep is you got to get restful sleep at least 7 hours or 7 to 8 hours per night. So you have to be active in your sleep, try to be sleepy by bedtime, have a sleep regimen, have good sleep hygiene. So heavy emphasis on sleep. And then it kind of ends up with mental health, which was a pretty good chapter. Overall, highly recommend the book. especially the beginning of the book. I thought the beginning of the book, when it talks about diagnostics and the changes in diagnostics and how we're better at them, so therefore we should be diagnosing things earlier. And sometimes we have to work outside of insurance companies that might not cover early diagnostics. Those chapters were excellent. The rest of the book was great. There was no problems with it. But the main takeaways from it is make sure you're exercising daily. Make sure you're focused on the 4 pillars of exercise, which is some type of resistance training, some type of cardio training, some type of intense cardio training, and some type of mobility and stability. For your cardiovascular health, make sure your cholesterol is in check and as low as possible. And you might need to take some medications to get that done. And then in terms of your diet, make sure that you're just eating less and you stay within a healthy BMI, that you're not getting any metabolic dysfunction. And the 3 main ways to do that are decrease the frequency of what you eat, increase your quality of what you eat, or decrease the amounts of what you eat. And then checking up other diagnostic testings for cancer. Make sure you have all your cancer screenings intact. If you do all of that, then you give yourself really good chances of living longer and increasing your health span. The main takeaway I would say is that in order to live longer, you have to be proactive with your health in your 30s and 40s. And so you should have a primary care doctor and then get all your health things under control, because they're much easier to get under control in your 30s and 40s. But if you try to get them to get under your control in 60s and 70s, it's gonna get much harder. All right, hope that helps. Sorry, this was a long video, but just trying to summarize it for you. Thanks.